Hi everyone, it's Dr. Angela Natoli of the Chiropractic and Functional Neurology Center. I am here again with Dr. Karla Mehlenbacher of the Giraffe Cafe, and she has a sidekick today, Maddie. Everyone say hi to Maddie. So today we're going to talk about, we're going to capitalize a little bit on what we talked about in our last video, which was the importance of posture and the importance of different developmental milestones that kids can meet. So today we're going to talk a little bit more about what we can do and what we can look for in our kids. So first of all, Dr. Karla, do you want to explain again why posture is so important?
Yeah, so the basics, to keep it really simple, is that we start off completely reflexive, and we are moving creatures, which is why we have a nervous system. So if you think about the fundamental level of what is the nervous system, it's to help us move and interact in the world. So everything we do as humans is based off of movement. So we have to have a foundation of that, which is reflexes. So a lot of people have heard the term reflexes, and they think of like the knee jerk, which is one, yes. But there are also tons of other reflexes that can give us windows into how the movement is functioning. So kids have reflexes when they're coming out of the birth canal right away, even being able to turn their head and come out of the birth canal, knowing how to get and clasp onto the breast. Those are all reflexes that come with the baby. So we can check for these things and see, are they integrating properly? The next level of motor development is then being able to control their own posture. So they pick their head up and then they sit up, and they get their own form of safety in their selves. So they rely less on mom, and they can start integrating these reflexes and having their own control. A perfect example of this is the grasping reflex, which I mentioned in the last video. When you touch a baby, they will hold onto your finger and not let go. And this is because they need to hold on to mom to survive. Well, eventually they can hold themselves up, and they don't have to necessarily hold on to mom because they feel safe, and then they can integrate a more complex function. So the basic foundation is reflexes. Then we get posture and gross motor, meaning mostly core strength. And then we get fine motor and then cognitive thought. So thought really is just a bunch of micro movements in the brain, because it's, again, a bunch of micro connections of the nervous system. So you can't jump straight to behavior, especially in kids. You want to start with the foundation, and then you can judge the behavior and the fine motor and the cognition, because that's going to be the last thing to develop.
Yeah, so it's like building blocks. You can't build the roof on a house until you've done the basement and the foundation and the rest of the house, essentially. So let's talk a little bit now about what primitive reflexes are. So we talked a little bit about this yesterday in our last video, and primitive reflexes are basically there to help us survive as infants, as newborns, right? And then as we get older, we don't need those anymore to survive because we can use higher brain function in order to do that. So today we're going to have Dr. Karla give some examples of primitive reflexes on Maddie here. So I'll give it to you, Karla.
Okay, so I'm just going to show a couple of the basic postural ones, because these are the most common with ADHD, dyslexia, common developmental disabilities that we can look for. And common signs in school are like not being able to sit in the chair, being constantly distracted by all the sounds around them, constant fidgeting, not being able to hold the pencil correctly. These are all kind of windows that they might need a little bit more into the integration of those. So I'm going to give you an example of the most common one, which is the asymmetric tonic neck reflex. So if you can, Maddie, get on your hands and knees. I want to make sure you guys can see this. Yeah, perfect. Okay, so come a little bit more forward. Great. So you want to have the child on their hands and knees. There's two ways you can test this. One is tabletop and the other is standing. So we check both. So the child will be just relaxing, and I'm going to turn their head. So you want to move their head for them. So we hold for one direction, and we're seeing if we're going to get movement in the arm. So we go each side. So a positive test would be if I turn her head and she had a bend in the elbow like this, like a baby. So then stand up for me. And then face that way. The next way is standing. So same thing. Let me see if I can raise it up a little bit. So arms straight out in front. Just have them keep their arms straight up, close your eyes, and then you also turn their head in each direction. So you're looking to see It actually might be better if you face the camera. Keep your eyes closed. So you're looking to see if they can keep their hands in straight in front of them. A positive reaction would be if they keep your hands up, move your whole body. So that would be a positive reaction if their arms went with the head. In adults, if this is present, you'll notice it when you're driving the car and you turn your head and you turn your steering wheel with it. So these are signs that can come out from injury later in life, or even if it was never developed properly in the first place. So that's a really good one to check. That one actually happens when you're exiting the birth canal, and it's the first sign to make them start to crawl and separate their head from their neck. So as an adult, we should be able to turn our head without moving our whole body.
Absolutely.
So that's a super simple one to check. We can do the spinal gallant. So this one is super common in kids that have poor posture. They always slouch in the chair. They are maybe bedwetters. This is a reflex from the vestibular system. So same thing, get on your hands and knees. And that way. So it is best to do it on the skin. So when you ever touch a baby, they will curl into your hand. So this reflex should be integrated by about 3 to 9 months. It's different for everyone, but past 9 months, you want to make sure this is gone. So if a kid is bedwetting beyond 5 years old, this is when we want to definitely check this. So we scrape down towards the sacrum, and what you're looking for, a positive reflex would be if she were to curl into the reaction. Thank you. So again, the ways to integrate these, if they are present, depend on the individual. It's not an easy cookie cutter answer, but it's just an indication that we maybe need to do a little something with posture, or maybe, again, like we talked about in the last video, that can also include chemical and energy levels. And then let's do one more. Let's do this symmetric tonic neck reflex. So this one is also one of the most common that's found in developmental delay. This comes when the child should start to crawl, so around 6 to 9 months, and it should be fully integrated by about 11 months. So this is when you start to see like the scooting and army crawling, or the kids that sit in like a W position, have very poor muscle tone, hand-eye coordination. So you have your hand and knees, again, tabletop. So same test, you want them on tabletop position, and then you ask the child, make sure you're even. And then look straight up at the ceiling. Have them hold for about 3 seconds. And then chin to chest, look all the way down at your feet. And then hold. And then do it again a couple times. So you always want to check a couple times. A positive test would be if she were to go down, here, bend forward, your head forward, and then she would bend her elbows in, like that. So like a baby. When you go up, you would come back on her feet. So you'll notice babies will do this right away. They just kind of sit back like this. So we should be able to separate our top half from our bottom half. And that's what a lot of this is starting during that time.
So these
do you want me to clarify any? Was that good?
Well, so these are some tests that obviously we do in the clinics, but maybe parents or someone could even do at home. Like no one's going to get hurt by having their kid, look up, look down, or checking to see how they can stand. So these are all really safe tests to do at home. And maybe it's something that a parent can do as well if they're seeing other cognitive issues like you said, concentration issues, or maybe there's bedwetting issues, or they're getting agitated by sounds and light that shouldn't be so agitating to them. These are kind of like little quick checks that that parents even can do at home. And then that can mean possibly that the building blocks aren't there yet, right? So maybe it's not just the behavioral issue. Maybe we have to back it up a couple steps and start from posture issues and from earlier building blocks. So what would be some things that we could do, say if some child came in and did have some positive tests, what would be some good posture exercises that they could do at home?
So again, this is specific for the child and individual, but there are some general core exercises that everyone can benefit from.
Right.
A really good one is the bridge. So this is when you're on your back. A lot of yoga instructors do this. You want to do it?
I do it at gymnastics.
Okay, lay on your back and do a thing. And then you keep your arms on the ground and then lift your hips up and see how long that they can hold. So this does depend on the age for the child, but if you notice that within a few seconds they're already starting to shake and losing control, you're not in the picture, but it's okay. Then you know that they might need to hold it a little longer. So I always say the goal is to get to about 90 seconds eventually.
Okay.
Without shaking. Start with whatever you can though. If they're already shaking and weak, just stop at 10 seconds, go back to it later.
Right.
You want to try and do them daily until it's really integrated. It really happens quickly. The beauty of kids is that they're so plastic that if you repeat it a few times, they got it.
Yeah, they're good to go.
And then the fine motor and cognitive is that much easier for them.
So what are some other kind of basic things? So again, we're not diagnosing or telling anybody treatments. We're just talking some at-home healthy things you can do to help your kids' posture.
Another great one is bird dog. This is also common in yoga and gymnastics. So on your hands and knees. And then when they're just starting out, you want to do one limb at a time. So you hold to straighten this arm straight out for you. And then thumb up to the ceiling. And then you want to look about foot or two in front and then have them hold that. If they're already getting weak from that, then just keep working on each limb at a time. So you want their arm to be about to their ear. And then see how long they can hold and then relax it. Do the other arm. You do each arm individually, thumb up towards the ceiling. Make sure that they're staying balanced. Okay, relax, arm down. And then one leg, straighten your leg. Flex the foot to the ground, look straight in front of you, right here, and then see how long they can hold that. So you want to do each limb at a time. As soon as they can advance from doing 60 seconds each limb, you do arm and leg at the same time. So yeah, flex this leg and this arm. Can you do it? Try it. So she is not quite ready for it, which a lot of people are. It takes time. But once you can hold each arm opposite, for I say 90 seconds, then you can advance to actually doing cross crawl motions. Yes. And this is good for even adults. Like we all need to, we can't just, get this as children and then say like, oh, I'm good. This is why yoga is so therapeutic, and working on our core posture is so therapeutic for everyone all the time.
If you look at a lot of people with neurodegenerative diseases even, so if we change the topic from kids to adults, if you look at like say a Parkinson's patient or someone in that kind of realm, they lose a lot of these as well. Mm-hmm. So sometimes those reflexes come back. So a lot of times when we're working with neurodegenerative diseases, we're actually backing up and starting with the building blocks over again. And that's why it's so important. So yeah, so these are just some at-home tips and tricks that you can look for in your children, or if you notice anything that you feel like is a milestone and we're a little bit past that, it doesn't mean that it's a bad thing, right, Dr. Karla? It just means that we might have to give them a little bit more time.
Yeah, I mean, I always say it's exciting to know that they can improve and there's hope, and not just I'm going to label them and make them think that something's wrong with them. We all have the ability to be as optimal as we possibly can. That's the beauty of the brain. Yeah.
So it's interesting to integrate how posture relates to brain development. So hopefully everyone found this helpful. And if you have any questions or comments or things you'd like us to talk about in the future, definitely leave us a comment and we'll try to get a video out for you. Thanks so much.
Thanks. Say bye, Madeline.
Bye. Bye, Madeline.